Hi, and welcome back to my channel. This week in my clinic, one of my colleagues, who is a speech therapist, came to me as I was ending my shift, and she complained that she was suffering from conjunctivitis on her right eye, and this was very red. She had a lot of itching, and it was also tearing up a lot. And it was the end of the workday, and she was suffering a lot from it. If you'd like to learn more about the techniques that I show in my videos, check out the courses I have available. I have balanced method acupuncture courses, both in English and in Portuguese, that you can purchase and learn about this technique. As it was the end of my shift and I had to get home, I didn't have the time to do a full treatment, but I wanted to do something to help her. I asked a bit if she had gone to the doctors already, what had happened. She told me that she went to the doctors and that the doctor diagnosed the conjunctivitis and that she was already medicated, but she was having a lot of symptoms, especially in the end of the day, because she had been working the whole day. So I wanted to alleviate some of her symptoms, especially because not only her right eye, which was the infected one, was having a lot of symptoms, but the left eye was starting to itch and to tear up too. So she was afraid that both eyes were going to start having problems. So I had to do a very quick intervention to try and alleviate her symptoms. And when I think of a quick intervention, especially if we're treating symptoms like a conjunctivitis where you have heat and itching, my first instinct is always to go towards bleeding. So I started working. As it was her right eye, I went to her right hand and bled Zuyuan. This is a Master Tung point that you can see over here. It's on the thumb. It's a set of 2 points, and it can treat pretty much any eye problem. Usually we needle these points, but in this case, as I wanted a very quick solution and I wanted to take some of the heat out of the system, I opted for bleeding. As soon as I did this, the right eye started to feel less hot, and she said it was easier to keep the eye open and it wasn't itching as much. So to continue the treatment, I did something that I always do when I want to take heat out of the body, especially if we're talking about the upper jaw, or even more importantly, if we're talking about the head, which is bleeding the ear apex. And I did that on both sides since she was having symptoms on both eyes. As soon as I did this, all the symptoms went way down again. So the itching on the right eye was almost nothing. The redness was also going down and the eyes were not tearing up anymore. I was almost ready to finish the treatment, so I asked her how she was feeling. She said everything was getting better, but there was still the feeling like she had sand on the inner corner of the eye. Well, I know there are a lot of representations of the eye. If you look to different TCM theories, you'll see a lot of different representations of which parts govern the eye. The one that I like is this one, where you can see several organs that control different parts of the eye. And as you can see in this scheme, the inside corner of the eye is controlled by the heart, or belongs to the heart. So what I did was, on her right side, I went to heart 9 and I bled this point too. When I'm working with Jingwell points, especially if I'm bleeding them, I usually don't care exactly for the location or the classical location of the point. What I will do is I will squeeze the finger. Of course, you have to be on the right finger, but as you squeeze, you will see that one of the corners of the nail will be more red than the other one. And that is the spot that I will choose to bleed, even if it's not exactly the spot known as the Jingwell point for that channel. as long as you're on the right finger, if you do this, you will get great results for bleeding. So I did that on her pinky on her right hand. I pricked some drop of blood from her heart 9 point, and as soon as I did that, I asked her to blink a few times and tell me again how it was, and she told me that the feeling that there was sand in her eye had just completely gone away. So in an intervention that took me maybe 5-6 minutes, I did bloodletting on 2 points of the hand and on both ears, and most of her symptoms were gone. Of course, her eye was still, her right eye, which was the infected one, was still redder than the other one. She was still feeling some discomfort, but a lot less than in the beginning. I called her the next day and she told me that the relief was still there, meaning after 12 hours, there was still less itching than before, still less heat than before, and still less redness, and all the tearing up had completely gone away. So as you can see, this is a great representation of how acupuncture can have really quick results. In this case, combining acupuncture with bloodletting techniques, I was able to, in 5-6 minutes, relieve a lot of discomfort on this patient. If you like this video, don't forget to like and subscribe to the channel, and share these videos with your contacts so more people can know about how acupuncture can help them and help the channel grow.